So I'm going to be doing a central line dressing change. The first thing I'm going to do is identify my patient, identify the physician's orders. I'm going to gather my equipment, and I'm going to check with the hospital protocol for this procedure. First, a central line, it would be indicated, like why would a patient need this? It could be for kidney dialysis, chemotherapy, fluid resuscitation, any type of long-term IV access that the patient needs. A central line is a better idea than doing a peripheral IV where they're constantly obliterating those veins down there. So central line is better for long-term. So once I identify my patient in the physician's orders, I'm going to wash my hands, and I'm going to don clean gloves and a surgical mask. I'm also going to give the patient a surgical mask if they need it. They would need it if they aren't allowed to turn their head away from you. So any contraindications with the patient turning their head, they would need a surgical mask as well. So we could give them one. So we're going to take off this tegaderm that's on. I know he does not have one on, but for demonstration purposes, he'd have one on. We're going to take it off, and we're going to dispose of that. We're going to take off our gloves, dispose of our gloves, and we're going to rewash our hands. And we're going to have our equipment ready to go. And now we're about to get into the sterile field. So we're going to open our equipment away from us, making sure that that stays down. And we're going to take our sterile gloves out. And put these on. We got our sterile gloves, and we're going to take out our drape. I'm putting shiny side down. And now we're going to take our equipment supplies out and put it on the drape. Okay. At this point, we're going to assess the wound and the insertion site at the catheter. We're going to be looking for any type of redness, infection, swelling, any reason that the patient is not taking the catheter well. So he's not having any signs of that. So we're going to take our alcohol swab, and we're going to clean. We're going to go vertical, horizontal, zigzag, just cleaning all around the catheter insertion site. We're going to throw those away, and we're going to take our sponge, and we're going to scrub that in circular motions. And then throw that away, and we're going to let that air dry. Once that's air dried, we're going to take our tegaderm. And we're going to fasten it on top of the catheter like that, and making sure to take off the backing. And then throw that away. Okay, and now we can take off our gloves, wash our hands, and take off the mask. And now we can we're gonna label the dressing with our initials, the time, date, and how the patient tolerated it. We're gonna document how the patient tolerated it, the time, the date, where it's located, and the assessment findings that we had of how the wound looked.